everyone. This is take 3. This is the equipment you were given to take home for subcutaneous injection practice. We're going to go through it. This differs to what you would use in the lab a little bit, and I will show you the full procedure using the lab equipment in a minute. Pool noodle, syringe, drug, subcutaneous needle, which is 25 gauge, and I've got a swab. Okay, hand hygiene. Now, when we're opening the packets of this equipment, we've got to protect the key parts. The key parts is anything that will connect to anything. So for example, with the syringe, this is a key part. If I touch it, it's contaminated. So when you're opening your packets up, you can leave them in the packet. Similarly with the needle, this orange exposed bit, that's a key part. We do not want to touch it. So we'll just leave that in the packet as well. And then we've got the drug. Okay, now we would be checking the drug name, milligrams or units, and also expiry date. I'm going to use the syringe to draw up the drug because I do not have a drawing up needle. Today I need to draw up 0.5 mils of the drug. Very carefully, without contaminating that key part, I will draw up 5 mils. In fact, I'm going to draw up a little bit more than 5 mils, or 0.5 mils I should say, because there might be a bubble. And yes, there is a bubble. Need to get the bubble out. The bubble has to go up the spout and be ejected. And remember I said I want 0.5 mils. So I'm going to squeeze that out until I've got exactly 0.5 mils. No air. Okay? Now I can attach the needle. Protecting your key part. Everything is safe now. Alrighty. Going back into the patient. Swabbing is optional. Swabbing is usually indicated for people who are immunocompromised or vaccinations. You do not have to swab. You can choose to swab, however. So if I was to swab, 15 seconds, that's around about enough. Let it dry for 30 seconds. I approach the patient and I choose an appropriate subcutaneous site. I would pinch the skin or lift it from the muscle layer, which means just supporting it firmly. Taking the cap off the needle, just push that little green bit down too. Take the cap off the needle. What angle will I go at? Well, it depends on the size of the needle and also the size of the person. If it's a very short subcutaneous needle, we go in at a 90-degree angle, which is straight down. If the person has a lot of subcutaneous fat, we go 90 degrees straight down. If someone's quite emaciated, very thin, we might choose to go on a 45-degree angle. So get to know your angles. Today I'll go on a 90-degree angle. 30 seconds later, the skin is dry. 1, 2, 3, in we go. It's up to you how you choose to use your hands, but I am going to just inject and withdraw. Now this would normally go into a sharp spin. You've got a safety cap that can be clipped back on. If you clip that cap on, you can't use the needle again. So just put it up the cap, but it's not perfectly in yet. So it can be reused again and it's quite safe. Okay? And then we monitor the client, do our documentation.